Before I begin the weekly briefing, I want to provide a quick update on the Ahmaud Arbery case. As you know, over the past few days there have been several important developments. As many of you know, the Georgia Bureau of Investigation officially became involved in the case on the evening of Tuesday, May the 5th. Less than 2 days later, on Thursday, May the 7th, Gregory and Travis McMichael were arrested for felony murder and aggravated assault of Ahmaud Arbery. Both men are currently jailed in Glenn County. On Friday, May the 8th, that would have been Ahmaud's 26th birthday. Georgians from all across our state ran 2.23 miles to celebrate his life and to draw attention to the case. As you can imagine, this has been a very emotional time for our state. Our prayers remain with his family, loved ones, and the community as a whole. There are many questions that have yet to be answered, and frankly, Georgians deserve the truth. Attorney General Chris Carr announced yesterday that Cobb District Attorney Joyette Holmes will lead the prosecution. He also urged the Department of Justice and GBI to conduct an investigation into the process that delayed justice. I hold great confidence in Joyette Holmes, state law enforcement, and the Department of Justice. It is my belief that truth and justice will prevail in Georgia. A key part of our plan to ensure a healthy and prosperous future for our state is contact tracing. With nearly 250 staff in the field today, the Department of Public Health is making progress. Under the leadership of Dr. Toomey, DPH plans to have 1,000 staff deployed in the weeks ahead. To streamline contact tracing across the state, we are rolling out a new online monitoring tool, the Healthy Georgia Collaborative, which will allow Georgians to identify contacts and monitor symptoms. Health data will remain completely confidential. This monitoring tool does not collect any data other than what was entered by the contact. This is how the process is going to work. Residents who test positive for COVID-19 will be contacted by trained public health staff who will work with that individual to recall anyone they might have had close contact with while infectious. Those contacts will then be interviewed by the Department of Public Health to help us map and isolate the spread of COVID-19 in communities across our state. If you are contacted by DPH staff, I want to strongly encourage you to participate in the contact tracing program. We need your help to defeat this virus. Together, we can continue to take measured steps forward in the days ahead. On April the 20th, I issued an executive order to reopen certain businesses that were shuttered during our statewide shelter in place. I'm very proud of these hardworking Georgians for following the guidance, keeping both their employees as well as their customers safe. I also stand with the small business owners and others who decided not to reopen their doors. These men and women have a choice, and I appreciate the incredible challenges that they face every single day in this environment. Today, I've issued a new executive order to extend several provisions, clarifying existing guidelines for certain businesses and providing guidance to other operators in our state. This order is issued as COVID-19 positive hospitalizations, ventilator use, and percentage of positive cases continues to drop. It is based on data, science, and the advice of public health officials. Many have warned of a second wave and asked if we are willing to change course if conditions decline. Let me be clear, we will continue to track the numbers and continue to heed Dr. Toomey's advice. We will take whatever action is necessary to protect the lives and the livelihoods of all Georgians. In light of this new executive order, live performance venues, bars and nightclubs must remain closed through May 31st, 2020. I know this extension is difficult for many Georgia business owners in communities that have music venues. However, we believe that waiting a little bit longer will enhance health outcomes and give folks the opportunity to prepare for safe reopening in the near future. All Georgians must continue to follow social distancing, and gatherings of more than 10 people remain banned unless there is at least 6 feet between each person. The gathering ban applies to all non-critical infrastructure businesses, local governments, and organizations of all types, including social groups, informal get-togethers, and recreational sports, just to name a few. We continue to strongly encourage people to wear face coverings when out in public, and we thank everyone for their willingness to do the right thing. The shelter-in-place provision for the medically fragile Georgians, age 65 and older, remains in effect through June the 12th, 2020. Mandatory restrictions for sanitation and social distancing will remain in place for all non-critical infrastructure businesses and for recently reopened businesses. We are extending the industry-specific restrictions that we have had in place. Those will remain in place through the end of the month. As businesses slowly reopen in some enhanced capacity, we know that many are safely returning to their place of employment. While returning to a new normal is exciting, the current guidelines make it difficult for parents to find childcare for their children. This new executive order will increase the number of people in a single classroom of a childcare facility from 10 to 20 people, so long as the staff-to-child ratio set by the Department of Early Care and Learning are also maintained. We are told by the Department of Early Care and Learning and Public Health that this expansion can be done safely and allows for more facilities to be able to reopen. Child care facilities must continue to adhere to 13 minimum mandatory criteria to be able to operate, including strict screening procedures and sanitation mandates for frequently touched items and surfaces. In that same vein, countless families have reached out to my office to discuss how summer camps can safely operate as we battle the spread of COVID-19. Working closely with the Department of Public Health, constituents, as well as summer camp operators, we have developed strict criteria so that these camps can start planning now to reopen with safeguards in place. We are hearing that the Centers for Disease Control and Prevention will be issuing guidance soon. When that happens, their guidance will control. But until that time, we will put out guardrails so people can begin making plans. We have defined summer camp as any entity offering organized sessions of supervised recreational, athletic, or instructional activities held between typical school terms, including entities commonly referred to as day camps. Starting May 14, 2020, summer day camps are allowed to operate if they can meet 32 minimum mandatory criteria. These requirements are extensive and cover a wide range of operations to ensure the safety of camp workers and participants of all ages. Even though we have these measures in place to allow for summer camps, we are not allowing overnight summer camps in Georgia at this time. We will continue to watch the data, keep a close eye on compliance, and make decisions based on a case-by-case basis when Dr. Toomey and the Department of Public Health determine it is safe to resume overnight camping or campers. Throughout this pandemic, our restaurant owners and their employees have done a remarkable job in keeping local families fed. These hard-working Georgians have followed the rules, doing the right thing, even when quite honestly it wasn't very easy to do so. In our new executive order, we are taking another step forward, empowering restaurants to expand operations safely only if they choose. Moving forward, we will allow 10 patrons per 300 square feet of public space in restaurants and dining rooms, and increase the party size per table from 6 to 10 people. For gyms and fitness centers, we have made some minor revisions to the mandatory criteria, all based on public health guidance to allow for enhanced flexibility. But strict social distancing and sanitation rules will still apply across the board. This crisis, as you know, has been an unprecedented challenge for state government. Agencies have met this challenge and continued to provide critical services to the people of Georgia. I'm proud to the thousands of state employees who have done an incredible job teleworking and adapting to the new normal. To ensure that quality of service continues, starting May the 18th, specific divisions of state agencies will begin to phase back into limited in-person operations. In my executive order, I have tasked the Department of Administrative Services with promulgating guidance for state agencies to safely reopen their offices. As we work through this process, we will issue that guidance to employees, contractors, and constituents. We will be making more detailed announcements in the coming days on how we will be phasing into limited in-person operations at state agencies. I'm very thankful to President Trump, Vice President Pence, the Coronavirus Task Force for their leadership as we continue to fight the spread of COVID-19. As of noon today, Georgia has received our first shipment of remdesivir from the federal government. We have received 30 cases with 40 vials of the drug per case, and we will be working with officials in the Department of Public Health to determine how it will be distributed. We also deeply appreciate the equipment and supplies that we have received from the Trump administration, including our May shipment of testing supplies. We had a great call yesterday with the Vice President, as well as many governors from across the country, and we certainly look forward to working with all of them in this continued partnership. During that call, the White House issued a call to action encouraging states to aggressively test nursing home residents and staff over the next 2 weeks. Thankfully, we've been doing a lot of that here in Georgia for several weeks, compliments of the Georgia National Guard. I certainly want to thank General Cardin and his troops for a job well done. As of today, they have tested 46% of nursing home residents and 24% of the staff at those facilities. We estimate that there are 46,000 people who still need to be tested. In total, the Guard has tested 142 nursing homes, and they continue to move forward like they have with their infection control mission until that mission is complete. Speaking of testing, I did want to mention again that testing is available to all Georgians, regardless of whether you have coronavirus symptoms. Anyone can call their local health department to get scheduling for a test. They can also download the Augusta University Express Care app, visit augustahealth.org, or call 706-721-1852. Staff will schedule your visit to one of our 105 state-run testing sites around Georgia. The percentage of positive cases for COVID-19 continues to drop even as we ramp up our testing, which is certainly an encouraging sign. But here are a few things that everyone needs to know about the data as we move forward. Many healthcare facilities and labs are not reporting negative test results to the state. We are working with them to get this data collected and published. Also, as we aggressively test more nursing homes and long-term care facilities, we may see a sharper increase in positive test results. However, by doing this, it will allow medical providers to intervene earlier and try to mitigate adverse outcomes among the most vulnerable of our citizens. Right now, nursing home, assisted living, and personal care home residents and staff make up 18.5% of our positive cases, and 49% of the total deaths involve nursing home, assisted living, and personal care home residents. We ask everyone to continue to protect the elderly and the medically fragile as we continue to work around the clock to ensure quick, convenient testing is available for all Georgians. Before I end this briefing, I want to emphasize a few points. Every day we are seeing reports that more and more people are holding off important medical screenings and vaccinations out of fear of exposure. Yesterday evening I read a Wall Street Journal article that new cancer diagnoses have decreased a staggering 30%. Please do not risk your health by delaying important appointments or treatments. Medical providers and healthcare facilities are open and they have safeguards in place for their patients. I also want to renew the call to action for all Georgians to heed the advice of public health officials, avoiding large gatherings and helping slow the spread of COVID-19. Your cooperation is making a difference in saving lives. Finally, I want to give a shout out to two hard-working Georgians who have continued to work tirelessly to help us keep everyone informed through this pandemic. Aaron Shoemaker and David Cowan report for duty to provide American Sign Language interpretation for deaf and hard of hearing Georgians at a moment's notice. Their efforts are vital as we work together to stop the spread of COVID-19 and to put Georgians back on a path to prosperity. So Aaron and David, thank you so much for your tireless work during this pandemic. And with that, I'll open it up for questions. And as I said, we have General King, General Carden, Director Bryson, Commissioner Frank Berry, and Dr. Toomey available too if anybody needs them.
Governor Kemp, thanks so much for this. Question for you. How concerned is Georgia in terms of folks from other states coming in, and what's being done to sort of manage that, if anything?
Well, I'm not overly concerned about that. I know that's been an issue kind of early on when there was a lot of air travel. Certainly that's been drastically cut. I think most of our visitors that are coming to the state are well educated like Georgians are. They're complying with the rules. Obviously, if they're going into our businesses that are open or enjoying our beaches or our state parks, they're having to provide by the rules. And from everything that I've seen and heard on our daily and weekly calls with law enforcement personnel, public health officials, we haven't really seen any issues with that. And I certainly would encourage all Georgians to stay and vacation in the state of Georgia, but if they decide to go somewhere else, I would ask them to take these best practices that they've learned here and use those in other states, and certainly follow the orders of my fellow governors wherever they may travel.
And real quick, Dr. Toomey had a question about data reporting. We looked at the Department of Health website, and I believe the first death now shows the death in Georgia was March 5th, not March 12th. Can you elaborate a little bit about that? Because I think when we first reported it was March 12th. The website now says March 5th. So we just wanted some clarity on that.
No, and I'll have to get back to you exactly what that change is about. We have been working to update and increase the capacity of our website and to allow to have it be more visually impressive and easy to access. And I'll have to ask the webmasters as to what might have led to that change, because I honestly don't know.
Thank you.